Okay, so let me go ahead and introduce Sammy. So, Sammy Kirschbaum is a master level social worker, brain spotting therapist, certified brain spotting consultant, and founder of the Lyme Resilience Collective. Her professional expertise intersects with her own lifelong experience with chronic illness and chronic pain. Sammy specializes in tick-borne illness and complex health challenges, including chronic environmental illnesses. She has extensive experience in suicide prevention, clinical mental health, and child protection services, which informs her trauma-informed and integrative approach. Using tools such as brain spotting and nervous system regulation, she helps clients build shame resilience, relieve subconscious blocks, and step into their full potential. She facilitates nervous system experientials and educational programs, support groups, and one-on-one services, supporting clients in cultivating emotional regulation, resilience, and improved well-being. Welcome, Sammy.
Hello, everyone. Thank you for joining us today for this exciting live event. I also want to say thank you to Dr. Goyle and his entire office for allowing me to come on to their platform and share today about nervous system health, regulation, and optimization. I really truly appreciate medical practices that care about optimizing health and looking at the missing pieces. And oftentimes that does include the nervous system. Today, we're going to be talking about the nervous system, of course, but more importantly, understanding how the nervous system can improve your health, recovery, stress tolerance, and your overall well being. My goal is to leave you with practical tools and ideas that you can explore immediately so you feel more empowered and hopeful about your health. I do just want to do a little check-in. I can't see everyone, and that's okay if your camera is off, but I do want to ask everyone to check in with their own body for a moment before we get started to see how your nervous system is actually showing up today. Maybe you had a really long day at work. Maybe it was stressful. Maybe you just got out of traffic and there was some road rage. So just take a moment and I want you to take a couple deep breaths in through your nose very slowly. And when you're breathing, by the way, we want to do diaphragmatic breaths. So a way to make sure we're breathing in a correct, optimal way is to place one hand on your chest and one down on your stomach or your diaphragm area. So when you inhale through your nose, I want you to notice if your stomach expands 360 like a balloon, or if you're stress breathing and your shoulders are coming up towards your ears. So take a couple deep breaths in through the nose. And when you exhale, exhale out through the mouth. Once again, in through the nose. Exhale out through the mouth. And then depending on how your nervous system is today, maybe you're feeling really good, very regulated, or maybe today was hard. Maybe you have a lot of pain. So one really easy technique that we'll start with today is just taking a deep breath in, and we're actually going to do an audible sigh out. So in through the nose and then and that's a really, really good way to release stress. Just repeat that maybe 2 or 3 times in your own environment now. Once again, in through the nose, out through the mouth. If you've ever been in maybe an argument with someone, which I'm sure the majority of us have, you will notice that sometimes people sigh, and that is a really good way that their nervous system is actually trying to regulate and maybe try to keep them from going out of their window of tolerance and raising their voice at you or continuing to argue. So understanding the nervous system is important because it influences far more than people realize. It plays a role in your pain, your fatigue, your energy levels, digestion, sleep, immune function, mood, and so much more. So when we talk about improving health, we're not just talking about medications or supplements or even just treatments alone. We're also talking about the environment that your body is internally operating in and around. And that environment is largely controlled by your nervous system and oftentimes other people's. When your nervous system feels safe and regulated, the body functions very differently than it does when it is feeling stressed or threatened, which we'll also talk about today. Before we continue, I want to demonstrate how powerful the mind-body connection really is. So we're going to do a little brief exercise again. I want you to close your eyes. And for a moment, just imagine that you are in your kitchen right now. Maybe you have some fresh lemons in a fruit bowl or on the table. And I want you to imagine that you are cutting that open on a cutting board. Now imagine that the lemon was cut in half and you have half of the lemon inside your palm. Notice how it smells. Notice how it looks. And then I want you to briefly imagine bringing your palm up to your mouth and taking a little bite into the lemon. Notice if anything just happened in your body. Most people will realize that they have more saliva in their mouth. Their jaw might tighten, maybe even they had a little shiver or a weird face reaction. And there wasn't a lemon, but your brain sent signals to your body anyways. And this is important because it shows us that our thoughts, our memories, and perceptions create real physiological responses inside our body. You can open your eyes now. And just remember that when we talk about stress, safety, pain, fatigue, the nervous system is always involved. The nervous system is constantly scanning for safety or threat. So if there's anything you take away from today, remember at its simplicity, it's either scanning for safety or danger, both inside the body and also, of course, the environment around us. Based on what our nervous system detects, it changes things like our heart rate, our muscle tension, digestion, our immune responses, and our energy. This means that the nervous system therefore also includes pain, which we'll discuss a little in detail today as well. To understand this better, we're going to briefly look at some of the basic anatomy and physiology so that the rest of the presentation makes a little bit more sense. The nervous system has two main parts, two systems. We have the central nervous system, the CNS, and we also have the peripheral nervous system, so the PNS. The central nervous system, you can remember down here, I have the brain and the spinal cord. And the PNS is all the nerves outside of the brain and the spinal cord. So when we think about the brain and the spinal cord, think of that as our control center. It processes information, it makes decisions, it helps us organize our thoughts. And the PNS will branch out into the body to your organs, your muscles, and the immune system. So the brain is constantly receiving information from our senses through the body. It goes up to the brain, and then our brain and spinal cord send that back down through the body. This communication system is happening every second of every day, even when we're not aware of it. So the automatic nervous system. Sorry, I meant to say autonomic nervous system. I have a little typo on here. One very important part of our nervous system is called the autonomic nervous system. And this system runs automatically. We don't think about it. And this includes your heart rate, your breathing, immune function. And it has two main branches. So this is something that you may have heard of. We have both the sympathetic nervous system, and we also have the parasympathetic. The sympathetic tends to be more overdrive and movement, mobilized type energy. And the parasympathetic is when we are in more of a rest and digest phase. So if you think back to when we talked about the lemon exercise, when you did that, you had a perception and then it creates the physiological response. Well, for a lot of my clients that I see, if they have a lot of digestive issues or slow motility, I recommend that they do a calming regulation exercise before a meal. And that will help them put their body in an optimal state so that they can digest more easily. We do need both systems as well. Health is not about being calm all the time. And actually, that would be really unrealistic to think that we're always going to be joyful, we're always going to be happy every second of the day. Health is actually about being able to activate when needed to keep us safe and then return to a relaxed state when stress is over. So, what's nervous system regulation then? When we talk about regulation, we're not talking about staying in one state like the happiness, joy, calm. It is defined by how the body is moving in and out of states of stress and how well it can settle and recover afterwards. The goal is also not to eliminate stress. We just want to move through this more efficiently. So let's talk about the window of tolerance, or what I like to call your optimal health zone. This is the zone where your brain and body will perform at its best. You can think clearly, be social, make decisions, stay emotionally steady, and handle stress more effectively. In this zone, stress actually improves performance instead of overwhelming you. Many of you might be able to relate to that with fitness training, for example. And when something stressful does happen, whether that is an acute infection, travel, poor sleep, a hectic work schedule, you're able to recover and return back to your baseline more quickly. Let's get into some of the states. And this, if some of you have heard, kind of also ties into polyvagal theory. There's three broad states that we can be in with our nervous system. We have the mobilized, which could be the fight, flight responses. That could look like tension, anxiety, pain. And it might feel like racing thoughts, irritability, muscle tension, trouble sleeping, or overwhelm. If the system gets overwhelmed or exhausted, it also can shift downward into what we might call a freeze or a fawn state. And with polyvagal theory, we call that the dorsal vagal collapse. And this often can look like exhaustion, numbness, chronic pain, depression, low motivation. And the important thing is that we move between these states throughout the day, and that's very normal. So I'm going to give a little example. When so I have chronic illness, and I see a lot of patients who have chronic pain and chronic illness. Before my chronic illness, my window of tolerance was maybe this big. And I kind of flowed up and down throughout the day. Maybe there was some crazy traffic and I went kind of up, got into my sympathetic, right? My mobilized. Maybe I had some anxiety. And then it went back down when I got to work. And I just kind of flowed throughout the day. That's very normal. But after, when you realize that you, when you become overwhelmed by different things in life, your nervous system can start to spike. So it can go beyond that top glass ceiling of the threshold. And then it can go down as well. And that would be more of the shutdown. So people often report to me when I became ill, it's crazy that I didn't have capacity to handle stress anymore. How could I be working a full-time job in the past? But now all of a sudden I have one doctor appointment a week and that stresses me out. Or I can't spend time with my family anymore because I can't tolerate being around them. Those are some signs that your nervous system could be dysregulated. So then how can we get you back into a regulated or the ventral vagal, which is your optimal zone? That would be the third broad state, which is nervous system regulation, where we're able to socially engage, think clearly, and be able to recover. Sometimes our nervous system has trouble resettling after stress. And this is what I see a lot of 99% of my clients. This does not mean that something is wrong with them, or that it's their fault or their character. So it often means that their nervous system has just been working very hard for a very long time. And sometimes people can see this with, I'm thinking of some people that also have shot adrenal glands because they've been in chronic states of stress for so long. This can happen with chronic stress, illness, inflammation, poor sleep, or long periods of uncertainty, hospitalizations, procedures. And the nervous system is designed to protect us. So if it believes that our environment or the body is still under stress, it may stay activated or shut down more than we would like. But the most important thing to understand is that this is a physiological pattern, and physiological patterns can change. This is probably going to be my favorite part of the presentation. So how does the nervous system, relate to pain? Pain is real. So before I continue with any points on this slide, I want you to know that if you feel pain, it 100% is real. It's not in your head, and chronic pain isn't imaginary, and it isn't a sign of personal weakness. Across the room from you, you might see someone reacting to pain, and you might think, there's no way that that person is in that much pain, right? We all have different pain tolerances. It's just in their mind, you might say, or made up. I know I've been medically gaslit throughout my chronic illness journey a lot, and I was told that it was other things like just anxiety or just depression, but that really wasn't looking at the full picture of how the nervous system intersects with pain. Decades of research and clinical experience show that pain is a complex interaction between the body and the brain. And I also want to share this little statistic with you because I do work with people who have been medically gaslit significantly. For every one person that actually has an illness anxiety disorder, such as being a hypochondriac, there's 200 people who have chronic pain. And 1 in 5 adults have chronic pain. So this is something that is very common. I also want to share that there are 2 types of pain. There's acute pain, which is caused directly by an injury or an illness. And this pain is protective, right? We have an increase of inflammation, and usually it resolves as the body heals. And it even protects us. Let's say we hurt our ankle, our body is sending signals saying, hey, stay off of me. I need rest because it wants to heal. Then we also have something called chronic pain. And also it can be called neuroplastic pain. And this occurs when the nervous system becomes dysregulated and overly sensitized. Even after an initial injury may have healed, the brain continues to interpret signals as dangerous, and pain can persist. Chronic pain is measurable and real as well. And something really fascinating is that functional MRIs can show activity in key parts of our brain during chronic pain. So there's 3 parts of the brain I want to talk on briefly. One of them is the anterior cingulate cortex, and this monitors for danger and threat. We also have the insula that tracks internal body sensations and assigns meaning to them. And then we have the amygdala. That one's pretty talked about pretty often in the nervous system space. And this activates our fear and anxiety in response to perceived threats. Because of this, patients often try dozens of treatments, surgeries, physical therapy, and pain can sometimes still persist. If nervous system dysregulation is present and the brain continues to amplify the pain signals, we might have to look at nervous system regulation techniques. So what is the good thing? The good thing, the hope that we all have, is that something called neuroplasticity exists. In the 20th century, for most of it, we believed that the adult brain was fixed and unchangeable, right? You probably have all heard that old dogs cannot learn new tricks. Well, it's simply not true. Small repeated experiences can change and help the nervous system to feel calm and safe over time. So regulation isn't something that you either are born with or that you lose at some point. It is a skill that you can train and you can also build. So how can we build regulation capacity? There are so many options out there. I have a couple resource slides so you can look at some of these as well in your free time or ask questions during the Q&A. But we are going to pause here because I have another exercise that we're going to do. And this one that we're doing first is a body-based approach to regulation. And then we'll also be doing one that is more attention-based. So if you can make sure that you're in a comfortable position, we're going to go back to our breath again first. And what I'm going to walk us through today is a technique that is called EFT, which stands for Emotional Freedom Technique, or it's also commonly called tapping. So we're just going to settle in our chair first. And we're going to go back to taking some deep breaths in through the nose, out through the mouth when you're ready. You don't have to count, you don't have to try to change it. I just want you to notice it as it is, because we can also check your breath after the exercise to see if anything changed. Okay, when you're ready, you can come back, just noticing different things in the room where you're sitting. Notice your body on the chair, the weight of your body on the chair. And I'm going to give an example today of one of the common phrases that I use with clients during EFT. But I want you to know that you can change it while we do the exercise today. So we will be saying a mantra as we tap, literally, different parts on our body. The mantra that I'm going to say today is, even though I feel anxiety, I allow my body to soften. If you're not feeling anxiety and maybe you're feeling tired today, you can say, even though I'm feeling tired, I allow my body to rest. So just an example. I want you to make sure that it fits for you. So we're going to start with 4 fingers on the top of our head, and we're going to start tapping. And I want you to pick a pace that feels good to you, not dysregulating. And also don't hurt yourself. So pick a pressure that feels good. Take a deep breath in through the nose. Exhale out through the mouth. And you can repeat after me or place your own mantra inside this. Even though I feel anxious, I allow it to soften. We're going to move with 2 fingers down to the inner eyebrow for the next spot. Even though I feel anxious, I allow it to soften. Beautiful. We're going to move our 2 fingers over now to our temple on the side of our eye on both sides. Even though this tapping seems weird, I'm willing to give it a try. And we're going to move to our cheek muscles. Even though I feel pain today, I allow it to soften. Now we're going to go above your upper lip and below your nose right here. This one's easier with one hand. Even though I feel tired, I'm going to be okay. We're going to go down to right below where your collarbone is to the tippy top of your chest muscles. Even though I feel pain, I allow it to soften. We're going to move now to underneath your arm, to the side of your breast muscle, underneath your armpit. Even though I feel pain today, I give myself permission to relax. Other side. Even though I feel tired, I give myself permission to rest. We're going to move to the last place, which we're going to do both hands in this little area on your hand for the karate chop portion. I like to use 4 fingers on this one. Deep breath in, exhale out. Even though I feel anxious, everything is going to be okay. And the last one, left hand. Even though I had a really long day, I'm thankful to be here. And now I want you to pause. Don't try to think of anything. Just notice how your body feels, if it feels any different. Some people might notice some very obvious differences. For others, it could be subtle. And for some people, they might not notice anything. All of those are normal and totally acceptable. We're actually going to move on now to the attention-based one. So I'm going to walk you through a technique called the 5-4-3-2-1 technique. This is one of my favorites. It's so simple, and sometimes EMS is also trained in this technique, and even firefighters as well, to help people calm down when they go to calls and the patients or clients are having a panic attack. So this one is very relaxing, and if you need to change your position, I just want you to look somewhere that feels calming. So if you have a big monitor in front of you and it's distracting, you don't have to look at the screen for this one. So what we're going to do is we're going to notice through our senses. We're going to first find 5 things we can see. We're going to go to find 4 things we can feel, and I'm going to walk you through all of it. But when we get started, I want your eyes to be open, and then I'll let you know when is a good time to close them. So once again, as always, I like always starting with a deep breath. Once again, we're getting in a habit. How can we regulate ourselves? Well, we're showing ourselves that we're safe. So going back to your breath is one of the most easiest and simple ways to do that. So once again, a nice breath in through the nose and exhale out through the mouth when you're ready. And what we're going to start by doing is we're going to look, but I want you to not just look, I want you to really see 5 different things in your environment. So I'm going to give an example. I might choose the tree that I see, I might choose this light on the wall, the door handle, my bag. I want you to notice when you look at 5 things, not just to look briefly, but to notice color, texture, the size, and maybe imagining even what temperature it has. So I'm going to be quiet and I'm going to wait about a minute while you all look and really see 5 different objects or things within your environment. We have about 15 more seconds. Notice how it felt to actually notice some things that maybe you never really looked at before. Next, we are going to move on to 4 different things you can feel. So for a couple examples before I remain silent so you can focus, you could feel maybe a fan. You might feel a piece of jewelry on you or your hair against your head, maybe your sock even against your ankle. I just want you to focus on what you can feel and really isolate 4 different things that you can become aware of that you weren't before focusing on it. If you finish early, just go back to your breath again, in through the nose, out through the mouth. Couple more seconds. All right, now we are going to pay attention to try to see if we can isolate out 3 different sounds that we can actually hear. You might notice cars outside, your computer buzzing. It's often easier to do this one outside, so maybe my voice needs to be one of the things that you hear. And now we're going to move on to 2 things that you can smell. This one sometimes can be a little tricky, so I often tell my clients you might need to smell your shirt or a blanket if you have one nearby, or even if you have tea or coffee near you. And for our last one, our last exercise is to notice our sense of taste. So if you do have something you could take a little bite out of, maybe your imaginary lemon, or you can bring tea or water to your mouth and notice texture, the temperature. And if you don't have anything to bite or to drink, you can just simply move your tongue around in your mouth and notice feeling your teeth against your tongue. And that completes our 5, 4, 3, 2, 1 method, a good way to orient to the environment around you. I am excited to see if anyone noticed anything from that exercise. If you did, please feel free to put it in the chat if you noticed feeling different at all. We also have cognitive and educational ways for regulation. I also teach people a lot, especially this one's good for kids as well, is that sometimes doing a reality check. So if I'm feeling anxious about something, I might think of this. What is the worst case scenario? Which probably my anxiety is somewhere on that path. What is the best case scenario? And then what is the most realistic? Right down the middle. And oftentimes, our anxious thoughts, worries, or fears are not so far in the middle to the reality. It's usually on the other end. I'm going to check the chat briefly. I feel more relaxed. I feel calmer, really mellow. Beautiful. I yawned 4 times. I love that. That is definitely a neurobiological release, we would call in the brain spotting world. That's great. That's a huge sign that your nervous system enjoyed that exercise, Russell. More attuned and present. Thank you. So how can we support a healing environment? Well, there's many ways, but let's talk about it in detail. Safe connections is a huge one that people often overlook. So spending time with people who also have regulated nervous systems can be very calming. I actually talk about nervous system health so much that when I come into contact with anyone, whether that's virtual or in person, I often am noticing how their nervous system is showing up with me. And then I attune, usually in a therapeutic sense, with my clients, how their nervous system is presenting. I'm sure many of you know that sometimes when you tell someone who's anxious to just calm down, that doesn't work. Their nervous system's dysregulated, and that's their rational brain. Um, they're listening to what you're saying, but they're not able to actually change how their nervous system feels just from you telling them to do so. I actually want to break for a second and show my little brain model because I think that that is important too. Here is a little model of half the brain. This would be the forehead. Here we have the brain stem. I like to say that the brain is into three different parts. So up here with all of our lobes, we got the prefrontal cortex, and all of the lobes up here would be our neocortex. So this is where rational thinking happens and meaning making. But down here, this is where the limbic system is. So when we're talking about nervous system regulation, this is what we're actually accessing. The limbic system, the brain stem, and then as it goes down and travels throughout the body. So spending time with people who are trustworthy and attuned to us can be very regulating. There's probably people in your life that feel really safe to be around, and there's probably people that you hang out with for a couple hours and you feel exhausted by the time you get home. Predictable routines is also important. We are creatures of habit as humans, so we want regular sleep, movement, and meals can help your nervous system. We also want positive cues such as light, sound, touch, gentle movement. These are all signals that it's safe to relax. Sometimes, too, we can foster meaning or purpose through prayer, meditation, connection to values or purpose. I know that is different for everyone. And all of these resources that I'm offering as ideas don't work for everyone, but it is important to find what works for yourself. And that will have to be through trial and error usually. This slide, I'm not going to go into all of the things on here. I know there is a lot of text. This is more of a resource for people to look at after the presentation. That is just some really great ways to optimize your nervous system. For my own healing journey with chronic illness and what I help clients with, brain spotting therapy has been incredibly helpful. I also have done contrast therapy with like going in the sauna and then jumping in a cold plunge. That was an amazing experience. I remember driving home recently from an event and I felt so calm my whole drive home. And it had felt like I just did 4 hours of meditation, but I didn't. I also know that maybe Dr. Goyle can speak on this at the end, but I believe that there is a zero gravity chair tool that he uses.
The
Dr.
shift
Goyle, did
wave.
you want to jump in?
Oh my gosh, I can't rave enough about this thing. So it was technology developed by Dr. North, who's a physiologist, exercise. I think he's exercise physiologist, but also has a PhD in uh, in nervous system regulation. And so he has invented this zero gravity chair that uses vibration technology with breath work and meditation in perfect sync and harmony to completely reset your entire nervous system. I've been intrigued by, I've known about this chair for several years. They use it, elite athletes use it, like the NBA, NFL, Olympic athletes use this. They've introduced it into the military now. So um, Navy SEALs use this chair because it can really help you get in the appropriate mindset for war. And then also afterwards to handle the stress and the trauma of war. So it helps with PTSD. They've got protocols in the shift wave chair that can be used for kids too. Kids who have PTSD, who have some kind of trauma or ADHD. Um, the protocols vary from being simply just relaxing the entire nervous system to revving up the nervous system to prepare you for whatever it is you're going to do. For example, like sometimes on Sundays I get really tired, and I usually Sunday's my catch-up day. So instead of taking a nap, I'll do 10 or 15 minutes in the chair, and it's got vibrating pulsations in the back of your body from your head all the way down to your feet, but the vibrations are very intentional, and they're stimulating different parts of your sympathetic and parasympathetic nervous simultaneously while you're doing breathing, very similar to what Sammy was sharing with us today. Deep diaphragmatic breathing, exhaling through the mouth. But all of this resets the nervous system and starts to synchronize it. And then they'll take you through these waves of vibrations where you inhale and then you exhale, all while you're listening to the guided meditations. If you want to, they have unguided as well. But at the end of it, when everything shuts off, I mean, for me anyway, I feel like I could float out of the chair. Or on a Sunday when I need energy, I feel like, whoa, I have like natural energy, not like coffee energy, but it's not like caffeine. It is natural energy that I produced myself within my own body just by releasing the appropriate neurotransmitters. And it's just a testament to show us that we have everything we need inside of us if we can just tap into it. And the chair is like kind of like a quick way to get there, maybe a little cheating, but not. I mean, I like it because it's not using medications, and it's all just using our natural ability to tap into the power of our own nervous system. So the zero gravity chair is not just a zero gravity chair. It's got a lot of cool technology. So eventually we're going to be bringing it into our practice. So stay tuned. We just don't have room for it here in our current practice, but things might be changing in the next few months. So, but anyway, that's my experience with the zero gravity chair. It's called a shift wave. And so you guys can look it up. It's on, you can find it on YouTube. You can see examples of it. There are places in town that have it as well. So if you're interested, just shoot me a message and I'll be happy to get you in touch with the people who have shift waves that you can actually use for 30-minute sessions at a time.
That's amazing, Dr. Goyle. Thank you. I think it's incredible that it's not just the chair, it's using the vibration as well. I keep hearing in the nervous system circles about how important vibration plates are and all these different stimulators. So
Yeah.
I'll have to try the shift wave out sometime. The fact that you get that natural energy, and maybe instead of the nap on Sunday, you can do that. And not only to feel neutral after, but to have that increased energy is phenomenal. Wow.
It's amazing. I got one more thing I want to share about that chair really quickly. So a lot of people who know me and who see me know that I do these biologic therapies. Some of you on this call have gone through that, and they know that usually the first 3 to 5 days afterwards can be really rough sometimes. I just saw one of my patients today. He's a great guy, but I treated his shoulder. He had something called calcific tendonitis, which is where you get calcium built up on one of your rotator cuff tendons. And so under ultrasound, I went in there and I broke up the calcium with a big needle and injected bone marrow stem cells around it. And of course, afterwards, he wasn't very happy. He said it was pretty intense pain. But he went to a facility that has a shift wave chair, and he said it was on day 5, and he went in with like 8 to 9 out of 10 pain, couldn't move his shoulder, did a 30-minute session on the shift wave, and he said all his pain went away and it hasn't come back. Like it's been gone since that moment. And we talked about it today again because it's been 6 weeks since his procedure. And he's like, dude, my shoulder's 100% pain free, great range of motion. And he's like, it's great. He's like, I'm sure the bone marrow stem cells are working, but he's like, the shift wave, day 5, pain gone. So it's just, the power of the nervous system, and finding tools to tap into it, I think is incredibly important. And Sammy, I mean, you've been a wealth of information. You have all these tools that we can use. And I think it would be fantastic if the community reached out to you to go deeper into what you offer.
Thank you, Dr. Goyle. I also want to mention if you wanted to help speak on this, Someone asked about the PEMF mat. I know
Hmm.
that I recently started a couple months ago and I did notice a decrease in my chronic pain, but can you speak to the cellular health and healing of the PEMF mat?
Yeah, the PEMF does so pulse electromagnetic field therapy. This is just using energy and vibration, but at specific frequencies throughout the body. And when you set these frequencies to a certain setting, they can basically they do a lot of different things, but they can actually separate blood cells, have them flow better throughout our body. When that happens, they can actually carry oxygen to tissues that need it. So, I mean, PEMF does so much. So it can be anti-inflammatory and pain relieving, right? That's number one. It can be relaxing at the same time. So you can have settings that just really put the body into a more of a parasympathetic nervous system mode. They also have settings on the PEMF, and this is actually FDA cleared for compression fractures in the spine because the pulse electromagnetic field therapy can actually stimulate the cells deep inside the bone to turn over and produce healthier bone. So they're also using it not only for fractures, but also for osteoporosis or osteopenia. So it's something that if you're able to do it, might be something worth looking into because it can benefit pain, but it can also help support you on a deeper level.
Thank you for that explanation. That's very helpful. This is a prime example of how it's helpful when you are able to collaborate with a medical practice so that they can explain more of the medical side of what's happening with healing in the body. Thank you. I like to think of our body as a garden. So before you grow any new plants, you need to prepare the soil. In the same way, before your body can fully heal or respond optimally to treatments, procedures, and we want to prepare the body and the nervous system. This is where nervous system regulation does play a key role in your health because when our system is balanced, your immune function improves, your pain response will be more manageable, and your body can focus on recovery rather than constantly being in survival mode. Some ways to support this preparation include gentle movement, mindful attention to the body. We've talked about breath work, we talked about social connections, restorative sleep. I know is very important, and Dr. Goyle would probably talk about that with all of you in your sessions with him. And small, consistent practices over time are the most important compared to nervous system force. If you just were to do one nervous system exercise for an hour versus doing 10 minutes a day, that's going to have different impacts. What I bring is support for your nervous system, helping you build regulation capacity. And the important thing is that you're also working with your physician to diagnose, treat, and guide your care. Patience, why this is exciting as a collaborative approach to healing, is that you can build regulation and you can improve your stress management, your inflammation control, pain perception, and understanding your nervous system will help you be a more active participant with empowerment and informed approaches. Understanding the nervous system will also help replace shame or self blame with context, giving you that sense of empowerment that I'm referring to. I do have one more guided exercise that we're going to be doing. This is an acceptance and surrender meditation. I do just want to say, though, thank you so much for listening so far today, because I really want everyone to feel supported that there are tools and there are strategies that are in their control, even though nervous system regulation has so many opportunities, there's so many different paths to it. It is important that you take a look at how your nervous system is functioning and take a peek. Notice if it needs any improvement. There's usually a lot of signs that our body is screaming that it needs some more support in that realm. So I'm going to ask everyone to get comfortable again and go back to taking a couple deep breaths in through the nose and out through the mouth. We're going to be doing a short acceptance exercise. This is one that my clients with chronic pain find incredibly helpful. And acceptance here, just as a disclaimer, means allowing what's already here to exist without fighting it in this moment. Nothing needs to change during this exercise. You don't need to fix anything, and it might be helpful to just let go of any expectations. Going back to your breath, I want you to notice how it is right now in this moment. And notice where it's coming from. Are you doing that diaphragmatic breath, or is it coming from your shoulders again? Now feel the points of contact between your body and whatever is supporting you. You may find this exercise better with your eyes closed, and you may feel safer with your eyes open. I'm going to let that choice be yours. See if your shoulders can soften and drop a little, even if it just drops maybe a half centimeter, or maybe your shoulders drop a couple inches. Unclench your jaw. And if it feels okay as you go back to thinking about your breath, let your exhale be slightly longer than your inhale. Now gently bring to mind your current experience with either chronic pain or maybe a situation that's been stressful lately. As you do this, I don't want you to think of the entire story of this, not the fear or anxiety of the future outcome, just what is here right now in this present moment and how your body feels about it. You may notice symptoms in your body right now. There may be discomfort, tension, pain, fatigue. Instead of pushing any of this away, I want you to gently, inside your mind, repeat after me. This is what's here right now. We're going to say that one more time. This is what's here right now. You're not saying that this will always be here. You're not saying that you're okay with it being here. But you're simply acknowledging reality as it is in this moment. Notice if there's any part of you that's fighting your experience. By fighting, I mean maybe tensing against it, arguing with it, desperately wishing the situation or that this pain would go away. I want you to know that doing so is completely human. And with that said, I want you to see if you can soften the fight just a little. Out loud or in your head, you can repeat after me. I don't have to struggle with this right now. I don't have to struggle with this in this present moment. If it feels helpful, you can imagine or actually gently open your hands. This is a physical symbol of letting go of resistance. Once again, quietly or out loud saying to yourself, I allow this moment to be exactly as it is. I allow this moment to be exactly as it is. For the next 15 to 20 seconds, I want you to check in with your breath. Make sure you're breathing in through the nose, out through the mouth if it's comfortable, allowing your shoulders to drop, your jaw to relax, and wherever this fight or tension or resistance might be in your body, allowing it to soften. What's important to notice here is that acceptance doesn't always increase pain. It actually creates a little bit more space around it. Now bring attention anything that you've been trying to control in your life recently. That might be your body. It could be symptoms, outcomes, or timelines that you've put on yourself. And gently remind yourself out loud or in your mind, I don't have to solve this right now. I do not have to solve this right now. You might imagine placing all of that effort, worry, striving into an invisible container beside you. This is a really effective containment technique. You can imagine an invisible box or a real one, and you can put any effort, worry, or striving inside it. And maybe you can imagine placing it on a shelf somewhere within your home. Some people like to place it outside their home so it's further away. And maybe for you, this thing is so big and so heavy and so stressful that you want to put it in a box, take it to the airport, and ship it somewhere else very far away. Just for these few minutes, you're allowed to rest from managing. And don't forget to breathe in through the nose, out through the mouth. You can place a hand on your heart or somewhere comforting if that feels okay. And silently say to yourself, this is hard. I'm doing the best that I can. I give myself permission to be kind to myself. And if it resonates, you might add, I accept myself today exactly as I am. You can begin to gently bring your attention back to the room by slowly and gently opening your eyes. And we did the 5, 4, 3, 2, 1 technique where we noticed our senses. I want you to take your eyes and just notice the different colors you see. Notice the space between you and the wall in front of you. Notice the space between you and the wall to the right of you. Notice the space from yourself to the wall behind you. Notice the space to the left of you, above you, and also the space from you to the floor. And remember that acceptance is something that we practice moment by moment, and you can return to this at any time. I want to thank you all for being here today. I want to thank Dr. Goyle and his staff for inviting me to speak. I really do admire medical practices that care about looking at the nervous system health of their patients. because it's such a piece that is often overlooked. And my goal today was to leave you feeling a little bit more empowered, relaxed, knowing that your thoughts, behaviors, environment, your habits can influence your nervous system, and that your nervous system also influences those things as well. So when we start paying attention to our body, what helps us feel better, what increases stress, what helps us feel calm, we can have more success in our health goals, our treatments, our procedures, and recovery from those things. If anyone is looking for more support or wants to learn more about nervous system work, I am a certified brain spotting therapist and also do nervous system coaching. And I'm happy to talk with you after. If you'd like to reach out, I am going to put my contact information up on the presentation and we can open up for Q&A.
Sammy, thank you so much. That was fantastic. Like I put in the chat there that normally at 5:30 p.m. at the end of my day, I'm not this relaxed. Because now I'm thinking about all the stuff I have to do now that my work day is done. Now there's more work, but right now I just feel really mellow and really chill. Almost like a shipwave session. So, no, it was great. No, thank you so much. I mean, you truly are extraordinary. And, I think especially doing what I do the way I do it, like this component of it is something I don't tap into with many of my clients and patients that I see. And I think it's so incredibly important. I do emphasize the importance of like nervous system reset and getting that parasympathetic system in tune. As you mentioned, I mean, that's when most of our healing occurs, right? That's when we actually, while we're sleeping, when we're in that parasympathetic state, we're releasing stem cells. They're going throughout our body and fixing what's wrong. We have anti-inflammatory proteins that get released when they're in that state also. And, one of the things I stress, not only an anti-inflammatory diet and lifestyle, but is also sleep hygiene and also finding time for mindfulness and connecting with yourself and really checking in and slowing your heart rate down, slowing your breathing down, because that's where this state of healing truly happens. So thank you for sharing that with everyone. Carl, so glad you were on. Yeah, this is truly special. Yeah, so it's great. What questions do you guys have? We're here, we have time, and happy to answer any questions. And make sure you screenshot Sammy's information or take a picture of it so you have it. Um, Should be a great part of a comprehensive pain management program.
I often tell people if their providers are not looking at nervous system health, they're doing them a disservice. And a lot of the clients that I see, I actually had a woman who just met with me today. She reached out because she said, my doctor, she has a tick-borne illness, Lyme disease, Babesia, and Bartonella, and she's trying to treat them. But she told me that her doctor told her that they can't start treatment and she won't work with her until she starts doing something to help her nervous system
Yeah.
because her doctor has seen it too many times that without this missing piece, the client is at a disservice and doesn't take on to their treatments as easily. So they really want to prep that soil that I was talking about so
Mhm.
that the internal environment, right? And you brought up some of the most basic things. Your sleep, we always forget the most basic human needs that we have. And all of those are important. And not being in a chronic state of stress is crucial for that. Thank you, Sherry.
Yeah, thanks, Sherry. It's great. Oh,
Thank you, Neil. He said, I'm surprised
oh yeah.
how much of my nervous system I neglect. You helped awaken some of that today.
Right on. Give me chills.
Mhm.
That's what it's about. Yeah. We need more of this in our lives. We all do. We all face stressors in our lives, whatever they may be. This is a nice natural way to tap into the power we have within us to overcome pretty much anything. It's just a little glimpse of what we got here today. And Adrian has a question for you, Sammy. What can you say about expanding the window of tolerance?
Yeah, so building our capacity. So when we talk about the window of tolerance, that came from the window of tolerance when we talk about stress. So doing things for our nervous system where we're in the more state of regulation, or our ventral vagal, that's our optimal zone that we were talking about, to expand that, that's when we got to take a look at that nervous system piece. And that can be basic things like breath work. You can use these different cool tools that we were talking about today, like the shift wave, or spending more time in nature, even that's something that people often overlook. But when we look at culture, my background also is in sociology. So, we have a hustle culture where we're always running. And if you even look over in Europe, like they take time during their lunch breaks, they sit outside, they communicate, they eat slowly. But with our culture in the US, we often are moving very quickly. So it is more important than ever, especially with social media and being accessible to everyone, that we put up boundaries for ourselves, to have time for ourselves to regulate. And I'm sure, Dr. Goyle, you can relate to that. You're very busy as a business owner, and there's ways that you can find regulation outside of work when you go home or on the weekend, so that you're taking care of yourself, so you can show up in the best of your ability to your patients during the weekdays. And for myself as a small business owner as well, I have a lot of boundaries where I'm not checking my emails on the weekend. I turn off my laptop by 6 p.m. So creating some dynamics and structure within your weekly schedule and routine can be helpful. I also do, there's an app that I would like to recommend. It's free. It's called Insight Timer. It has over 300,000 uh, different meditations, visualizations on there, and I actually use Insight Timer to go to bed every night. It gives me a nice little yoga nidra session where we pay attention to different parts of the body. So it's really about finding what works for you that helps you feel calm, and that's going to look different for everybody.
Yeah, Insight Timer is fantastic. It's a free app. You can download it. And I mean, there's thousands of meditations on there. It's a great place to get started. Also a great place to track your meditations also. But yeah, glad you mentioned that.
Adrian, yeah, absolutely. It's a good one. Adrian just asked if the
Hmm.
window of tolerance fluctuates. I will say yes to that. It definitely fluctuates. If you think about maybe a week, let's talk about the holidays, for example. If you have family coming in or you're traveling, the more accumulative stress that we're going through, even if it is exciting, it can still be exhausting on our system. And when we're feeling more, let's say we got a lack of sleep, we have family coming in, we have to host, we had to clean the house all week to prep for them. Your window of stress tolerance is probably a little lower by the time that your family gets there, because you're going through so much. So I oftentimes am working with people for interpersonal relationships on how to regulate when they're spending time with family members, or when their loved ones are going through hard times as well. I hope that that answered the question well. Let me know, Adrian, if you want any more clarity on that. I will say that I did answer it good. I will say I definitely see the window of tolerance expanding for people who actively put in effort to work on nervous system work. You can just tell that those individuals are much more regulated, and small, minor inconveniences do not impact them the way someone who has severe nervous dysregulation would. Something interesting that I didn't touch on that I would just like to share very briefly is recently I've been in some conversations because I work with people with chronic pain and they keep doing these medical treatments, but they're not seeing any results, right? And then they get the testing and it feels like a lot is wrong, but the test results and even imaging keeps coming back. And I wanted to share that even if pain started with a physical injury, certain mental patterns, looking at the mental health side of this and how the nervous system creates connections, it can increase how the brain interprets pain. So it kind of turns a dial up and makes some people more sensitive to pain. So there's four mentalities that tell the nervous system danger, danger, or that turn up that sensitivity dial, and I thought it would be kind of cool to share those briefly. The first one is meaning making. So, assigning reasons to your pain can increase intensity. For example, interpreting pain as dangerous tells the brain to keep the alarm on or to be ongoing. The second one is fear, worrying, pressuring yourself, self criticism, and hypervigilance keep the nervous system on high alert. We know that people with childhood trauma are very, very susceptible to chronic illness in the future and chronic pain. Number three would be conditioning. So the brain can form true or false associations with pain. For example, if you believe a specific chair in your house causes back pain, your body might react before you even are sitting in it. Or maybe you do sit in it, but your brain has conditioned, oh, that's going to cause pain. So I can only sit in it for a few minutes. And then lo and behold, look what happened. Now the pain had started. And lastly, number four is avoidance behaviors, which recently I saw a video on Dr. Goyle's Instagram that relates to this. It's avoiding movements, positions, or activities, and they reinforce the nervous system's danger signals. So, for instance, if you avoid an activity constantly, or let's say there is let's go back to the chair example. If you avoid a chair or constantly use maybe a heating pad, your brain can learn that normal activities are threatening, which can intensify pain. And I know for a lot of my clients who have environmental illness, they have become so anxious, and these neural pathways are so strong that if they go to this family event and they eat that food, then they have really mass food restrictions or sensitivities. They may not go to social settings because they're kind of anticipating that their pain will be worse. So then they avoid social gatherings, which then leads to isolation. So there's a lot of mental health dynamics that come into this with my chronic illness clientele.
Sammy, thank you so much for this whole evening. Your presentation was fantastic, and I loved the exercises that we did. I definitely felt a shift. I feel like I'm ready to go home and go to bed now.
Thing.
Yeah,
Yeah, really
Perfect.
mellow.
so we have Sammy's info is up on the screen. So if you haven't, make sure you screenshot that. You're more than welcome to reach out to her if you have any questions specifically. And we look forward to seeing everybody in a couple of weeks for our next session.
Thank you again, Sammy. Appreciate you. And thanks for everyone for tuning in. Have a great
Thank
evening.
you, everyone.
Bye.
Bye.